Hello guys. The diagnosis of this case is called bruxism. This is the involuntary clenching or grinding of teeth that can occur usually during sleep. It can be caused by stress, anxiety, certain sleep disorders, and lifestyle habits like alcohol and caffeine consumption. Bruxism often leads to symptoms like jaw pain, headaches, tooth damage, and can be linked to TMJ problems. Some cases can be directly treated with bite splints, like we showed in a previous video. But some cases require increasing the vertical dimension of occlusion, like this one. Take a look.
Very good, Dr. Beartooth. So now we have this 66-year-old male patient with history of bruxism, stress, and so on. And now you are seeing the fractured teeth in the upper left quadrant. Then a failing prosthesis in the lower right quadrant. So now what is the plan? First we need to re-establish the posterior occlusion of the left side. So first implants and extraction and then implants in the upper left quadrant. Those are XIVE dental implants. We have videos talking about the planning if you guys want to see how it's done. Look at the distance between the implants for us to have nice papilla. Now you will have the posterior occlusion of the left side, so that's very good. So now we have the new left side occlusion with increased the vertical dimension, but we had to remove the lower right prosthesis and all these molars will need to be removed as well. Take a look at them. And look at this crown of this premolar of the lower right quadrant. It's also failing as well, okay? But we are trying to keep this tooth for the moment. Okay, so then the lower left quadrant needs implants as well because those teeth were also failing. And then we have at least a very nice keratinized tissue. And now, as we establish the left posterior occlusion for good, then we can do composite build-ups to have the increased vertical dimension of occlusion, ideally at the time that you install temporary crowns for those dental implants. We can use this resin, which is a very good resin from Ultradent, the universal one. We need to check the occlusion with the registration with silicone. Now we can do the preparations. There are videos talking about how to do the preparations. Then you do the impression with PVS and you send to the lab to receive those copies of zirconia. Then you are going to splint the copies of zirconia. You can do this with acrylic resin and then you are going to do the transfer impression of these copies. So very simple because you need to make sure that all of them are fitting properly. You try in the PVZ crowns, the porcelain fused to zirconia crowns. And now you have finally this occlusion with vertical dimension increased. Now you do the upper central incisors, of course, and lateral incisor, and only then you can rehabilitate the right side of the patient as well. This is the final radiograph after the implants and the porcelain fused to zirconia crowns. See you guys on the next videos.